Okay. Well, welcome everybody. It's a real pleasure to be here today, and really exciting because we're here today to recognize our first adjunct professor of global oncology, Dr. Raj Rajagopal. And Dr. Rajagopal is here, and he's here with members of his team from Pallium, India. And we're also here to recognize the signing of a memorandum of understanding with the organization that Dr. Rajagopal leads, Pallium India. And it's great to see friends from Pallium India on the Zoom call today. It's great. Um, we have Dr. Jane Philpott, who's going to be joining us, the Dean of Queen's Health Sciences, and she's going to be making a few remarks. And Dr. Chris Booth, who was the first member of our team from Queen's Global Oncology to meet Dr. Rajagopal and form this really trusted and treasured partnership. We're here in Kingston, and we have Dr. Anna Boak, Dr. Jean Matthews, Dr. Vishal Giawali, Dr. Thuwanka Wijaratni, and Dr. Shaila Merchant. So we're all here to celebrate this really important day and to recognize you, Raj. Easing suffering is one of our most important responsibilities as healthcare providers, and I've been very fortunate to witness firsthand the members of the Pallium India team as they provide skilled and compassionate care to patients in Kerala. They go out every day and they take care to patients at home, and it's really inspiring to see them work. And it's really a privilege to be able to work with such a skilled and compassionate team. Their important work doesn't stop there, though. They're also committed to educating and training physicians across India so that more patients in India can get outstanding palliative care. Today, we mark the signing of a memorandum of understanding with Pallium India that formalizes our commitment to working and learning together with Pallium India. It really will facilitate ongoing collaboration that is based on strong friendships, but also a steadfast commitment to working and learning together to achieve our shared goals. And it's really an inspiring organization. I'm also very proud to announce that Dr. Raj Rajagopal, a truly inspiring figure, will be our first adjunct professor of global oncology. He's not only an incredibly skilled and caring physician and a revered scholar, but he's also had a profound impact on advocating for real and substantial change and advocating for improving access to pain medications and palliative care across India. Dr. Rajagopal is the director of the WHO Collaborating Center for Policy and Training on Access to Pain Relief at the Trivandrum Institute of Palliative Sciences. This organization was fundamental to the development of government policy on palliative care in the state of Kerala in 2008, and in 2012, establishing the National Program for Palliative Care in India. Dr. Rajagopal's leadership led to 17 of India's 28 states adopting simplified rules for stocking opioids and made a real difference for improving access to pain relief and palliative care in India. In 2014, Dr. Rajagopal's further advocacy was key to Indian Parliament passing the Narcotics Amendment Act, and both of the work he did on implementing these important pieces of legislation had a substantial impact on improving access to essential pain medicines for patients in India. Dr. Rajagopal is a member of the Government of India's Technical Advisory Group on non-communicable diseases. He's a commissioner on the Lancet Harvard Commission on Global Access to Pain Relief and Palliative Care and the Lancet Commission on the Value of Death. Dr. Rajagopal is also a member of the Ad Hoc Expert Advisory Group on Palliative Care of the World Health Organization. He works with the Access to Essential Medicines Program of WHO and with the India and Regional Office of Southeast Asia Offices of WHO. In recognition of his exceptional contributions in the field of palliative medicine, Dr. Rajagopal was awarded the Padma Shri, one of the highest civilian awards in India. And in 2018, he was identified as one of the 30 most influential leaders in hospice and palliative medicine by the American Academy of Hospice and Palliative Medicine. Before I hand over to others to make remarks, I just want to say that although we're formalizing our relationship with Pallium India today and formally recognizing this Dr. Rajagopal, this truly inspiring figure, this relationship is built on friendship. The formalized memorandum of understanding and the making Dr. Rajagopal an adjunct professor are important formal things. But this partnership is based on true friendship, a commitment to shared bidirectional learning, and a real commitment to working together. So although it's very exciting to announce these formal relationships, I can't say how much we treasure the friendship, your friendship, Raj, and the friendship of all of your team in Pallium. And it's great to see so many of the team here today. And with that, I'm going to hand over to Dr. Philpott to make a few remarks.
Thanks very much, Scott. Thank you for the introduction, and to Dr. Rajagopal and to all of your friends and colleagues in Pallium, India, and also to my colleagues here at Queen's. Good morning or good evening, as the case may be. It's a great pleasure to be able to join you in this celebration virtually. My name is Jane Philpott. I have the great pleasure of being Dean of the Faculty of Medicine, or Faculty of Health Sciences here at Queen's University. I'm also Director of the School of Medicine. At the Faculty of Health Sciences, we are delighted that, in fact, we are an interdisciplinary faculty with a School of Medicine, a School of Nursing, and a School of Rehabilitation Therapy. And I thought I would spend a little bit of time in my moments of commentary just commenting on how wonderful it is to be formally seeing ourselves as a global faculty today, to be able to see our impact and our reach and our partnerships around the globe. So I have been in the role of Dean here for just over 2 years now, and have been delighted to work with the incredible team here at Queen's University in Canada. We did some work early in my decanal term to look at what we wanted to do over the next few years. That's a common thing, I think, for a new dean to do. And we brought together over 1,000 people from across the faculty, staff and students, faculty members, community members, and alumni. And when we talked about what we wanted to do, a theme emerged rather organically, and that theme was what we have called radical collaboration. It's an emphasis that has come from our people about the desire to work together, to focus on partnerships, both amongst ourselves here locally, but certainly also around the world, and also a real desire to have impact on community. And I know that from everything that I have heard about you, Dr. Rajagopal, and your colleagues, based on what I've heard from both Chris Booth and Scott Berry and others, that we're very much aligned in our values and our guiding principles of the work that we do. And the celebration today very much fits with the concept of radical collaboration, to be able to become more and be able to do more for our communities by working together. Within that strategic plan and that focus on radical collaboration for a healthier world, we have emphasized a number of the priority projects that we will continue to work on. And one of them is to continue to develop our work in the area of global health. Those who are part of this call and part of Queen's know that work internationally has been a big focus, particularly for certain departments. And it's safe to say that the Department of Oncology has certainly been a leading light in terms of making sure that its impact is not just in our community here in this part of Ontario and Canada, but that it makes a ripple effect around the world. And so we have actually been bringing together many more of our partners in global health and working on developing an institute of our own that will formalize our work in global health, and certainly both global oncology and global palliative care will be a very key part of that. We're extremely proud. I'm extremely proud as Dean of the work of my faculty members who are there in the room today, and also, of course, they can't get their work done without their partners around the world. And the impact in terms of both cancer care and palliative care have been enormous. Topics that are very close to your priorities, Dr. Rajagopal, around access to essential medicines are certainly a big part of what we hope that Queen's will continue to be able to contribute to. And so we are on the verge of announcing very soon the name of our new Institute for Global and Population Health. I'll give you a sneak peek because we've been shopping it around a little bit amongst ourselves, but we have had a working group who have been working on putting together this institute. And we're going to be calling it the Kaleidoscope Institute, which we're very excited about. I'm not sure how many of you spent part of your childhood using those wonderful kaleidoscopes. Some of them very simple, but others maybe more sophisticated. But the concept of the kaleidoscope that comes together to be a thing of beauty because of all of the moving and colorful parts, and everyone playing a slightly different shape and a slightly different color, and over time changing, but always being a thing of beauty is the concept that we hope that our institute will play in terms of making the world healthier. So we look forward to sharing more about that with you as we go forward. But we know that our partnership with Pallium India and all of those of you on the call will be part of how the Kaleidoscope Institute will make its way to make the world healthier, to be focused on equity in healthcare, and to be focused on justice and fairness for all. So today I'm really happy to be celebrating with you this great example of collaboration. And I heard Scott talk about bidirectional learning, which it certainly has been. I'd like to argue that the work that you and we are doing together is multi-directional, even if it's today a little bit about the Queen's and Pallium India bidirectional work. We know and that all of us want for the ripple effects to go off in every single direction beyond that, and to have an impact well beyond our own institutions. Dr. Rajagopal, thank you for agreeing to become part of our faculty, to be joining us as the first ever global oncology adjunct professor. It's very exciting for us. Your reputation is well known here, and we are honored that you would become part of our faculty and thereby part of our family. Congratulations to you. Welcome to the Queen's University community. We look forward to continued growing relationship with you and your team there. And most of all, we look forward to knowing that because of the work that we do together, that more people will have access to care and compassionate care when they need it most. So with that, I say congratulations. Thank you very much. And I'll pass the floor, I think, to Dr. Booth from here. Thank you.
Thank you, Dr. Philpott. Good morning, colleagues and friends in Canada, and good evening to my dear friends in Kerala and beyond. My name is Chris Booth. I'm a medical oncologist here at Queen's, and I'm going to make some remarks, perhaps a little bit less formal, and maybe tell some stories about how I met Raj and the work that we've done together over the last 6 years. So I can still remember the day that I met Raj. I was living in Kerala at the time on a sabbatical with our very young family. And I was doing work at the Regional Cancer Center in Trivandrum, looking at access to care and patterns of care with colleagues there in oncology and surgery. And we had a friend over for an afternoon visit on the weekend, Dr. Chandra Mohan, a surgeon that many of us know well and continue to work with. And I asked Chandra, I said, I'm very interested in palliative care. Could you, introduce me to some of your colleagues that do work in this space? And in typical Chandra Mohan style, he immediately said, Chris, I'm going to connect you with the greatest palliative care physician in India. And he immediately pulled out his phone, and within 3 seconds handed me a phone while I was running a small daycare of children, and it was Dr. Raj on the phone. And Dr. Raj was gracious enough to take a few minutes to chat with me, and didn't know anything about me or what I was doing, but kindly invited me to join him a few days later to make house calls and to get to know more about the Pallium India organization. And I think it's just worth emphasizing, I'm so pleased to see this many of our friends and colleagues from the broad Pallium India organization join, because this celebration today is about Raj, but also about everyone that's part of Pallium India. I know that Raj, that's kind of a guiding principle of his. And so the group of people that have gathered from Pallium India really deserve, they're so deserving of all our respect and appreciation for all the work that you've done as part of this remarkable organization. So a few days later, I showed up at the TIPS hospital, and I met the team. And there's a team of minivans going out because in Kerala, much of the model of palliative care are these home-based teams, and this was pioneered by the Pallium India organization and Dr. Raj. It was taking palliative care to the people. And so I got into a minivan with Dr. Raj, and by this point, I knew that Dr. Raj was very famous, and I got to spend that day with him and many days subsequent to that. And we were in a small minivan traveling through these narrow and crowded streets of South India, making house calls. And it was, I've been practicing medicine for about 10 years out of training by that point, and it was just so refreshing because it reminded me of the essence of compassionate care and humanism, and why so many of us went into medicine in the first place. To witness Raj and the team, one of the social workers, the nurses, the driver, who also helped as the pharmacist and the general manager of the event. And so we made house calls to, I still remember the patients, an older man with Parkinson's, a family with a young adult child with profound physical disabilities, and then a young boy who was dying of a terminal cancer. And it was just profound to see Raj at the bedside delivering the care that he'd been working on, for many decades. And still, it was as meaningful to him to spend time at the bedside with a young family as it was for him to interact with the highest levels of leadership, both in India and globally. And just one funny anecdote: on the way to one house, Raj whispered something to the driver, and he pulled over. And Raj went in and bought some chocolate. I thought, oh, that's interesting. I guess Raj really likes chocolate. But we drove, and he was so deliberate in why he did that, because we went in to see a young boy who was probably 10 or 12 years old who had end-stage sarcoma. And Raj did not immediately go to the boy. He immediately went to the sibling, to the brother of the boy, because he knew that that brother was suffering just as much and probably was really lacking from attention because of the sibling who was very, very sick. And Raj went first to that person, recognizing their need, and made that young boy feel special and have some attention before he redirected his clinical visit to the young patient. And I'll never forget that moment. And so we had many days like that during my time in Kerala. Another story was I had discussions with Raj then about his amazing work in policy, because Pallium India delivers care. They educate providers of palliative care, and they work at the highest levels of policy, both in India and globally. And as Dr. Berry and Dr. Philpott have mentioned, have had a profound impact on how palliative care is delivered all over the world. And so Raj and I were in his office, and Ashla was keeping us organized that day, as she always does. And Raj happened to make a mistake in saying something. Well, in Kerala, they collect data on every milligram of morphine that's allocated to every hospital in the state. And we've been talking about challenges with access to care, and a light bulb went off. I said, Raj, well, do you think we should do something with that data? And Raj said, well, I don't know. What do you think we could do with it? And that kind of led to this ongoing joke about Raj made a mistake, an accident of showing me some data. And then that led to many, many projects where we've had much fun working together with a multidisciplinary team at Pallium India to describe issues about access, quality, and outcomes of palliative care across the Indian subcontinent. Raj, we've been privileged to have Raj visit us here in Kingston on 2 occasions. He came to give a very important Garfield lecture about 4 or 5 years ago, and then actually returned for a second visit in the middle of winter. And this is a story that I like to tell. There's a lovely photo in my home of Dr. Raj and his wife, Dr. Chandrika, with my 10-year-old daughter Adele outside, and Raj and Chandrika are dressed in kind of a hodgepodge of Booth family snowsuits, and they've made a snowman. I think it was the first time that Raj and Chandrika had made a snowman, and Adele was teaching them how to throw snowballs. And she still looks at that picture and remembers Raj and Chandrika. And the funny thing is that she just had a child's innocence and just had fun playing with some friends in the snow. And she had no idea that a few days later, Dr. Raj would be nominated for the Nobel Peace Prize. And so it's just kind of a beautiful imagery of what Dr. Raj and the organization at Pallium India have been able to achieve over the decades of work. So Raj, thank you most of all for welcoming me into the Pallium India family. Thank you for being a dear friend to all of us here at the Queen's Global Oncology Program. And thank you most of all for the work that you do the example that you set for all of us to become better physicians, better healthcare providers, better teachers, and most of all, advocates for the people and the communities that lack a voice when they most strongly need it. So it's a real privilege to formally recognize this. As Scott said, this is based on now many years of deep friendship, collaboration, and working together. And just to acknowledge the entire Pallium India organization, it's a great privilege for all of us to be here celebrating this today. So I'll now hand over remarks to Dr. Raj himself, who we can now refer to as Professor of Global Oncology. Dr. Raj.
Chris, Dr. Philpott, Scott, other friends, truly overwhelmed. How can I thank you for all your kindness to us over all these years? Thank you for being radical collaborators. What you do is to declare that we are one world, we are one nation, we are one humanity. And sitting on the other side of the globe, having some concern for the suffering people in our country. Oh my God. Thank you for organizing your kaleidoscope. And someday when we look through it, I do hope we will see a lot of beauty, the beauty of healthcare. Right at the moment, I won't say that we see all that beauty through the kaleidoscope. Today, when we look at things, we will see, unfortunately, quite a bit of unpleasantness, ugliness. The Lancet Commission of 2017 estimated that 51 million people in the low and middle income world are in serious health-related suffering that is unalleviated. In India, despite all the kind words that Chris spoke, with all our work over a quarter of a century, even today, less than 4% of our population has access to even basic pain relief. That's a sad reality. And the rest of low and middle income world is the same. So friends, thank you for your willingness to share the pain in our part of the world and to do something about it. Unfortunately, the global attention, particularly from North America, is all towards the medical opioids being inappropriately and non-medically used. That is visible. That's very visible. The 40 or 50,000 opioid overuse deaths in USA is very visible. But the 51 million people in pain are not visible. And that 51 million does not take into consideration the impact of healthcare in our countries. 55 million Indians subject to catastrophic health expenditure. Is that also not health-related suffering? If health is physical, social, and mental well-being. This is the grim picture. As Hinton wrote half a century back, as of now, as things stand now, we, the global citizenry, emerge deserving of little credit. We who are capable of ignoring the conditions which make muted people suffer. The dissatisfied dead cannot noise abroad the negligence they have experienced. They cannot go to court. Finally, the world is taking notice, though it's very doubtful whether much is being done about the low and middle income world. In 2014, the World Health Assembly, the decision-making body of WHO, advised all countries to integrate palliative care into all healthcare at all levels, primary, secondary, and tertiary, across the continuum of care, from the onset of the suffering to the end. It has been 8 years, ladies and gentlemen. In 8 years, for our part of the world, not much has changed. And I doubt whether it will change much if we just create guidelines and keep disseminating them. We need the kind of work that you, Chris, you, Scott, and your kind colleagues, all of them, do together. And right at the moment, I'm quoting a plastic surgeon from my state of Kerala in India. Jimmy wrote this last year. We often live in exalted orbits, inhabiting an idealized problem-solving scientific space, while most of our people needing desperate care fall through the cracks of our system, writhing in agony. We close our eyes and minds to the enormous Jurassic monsters facing us every single moment of our sojourn, pain and death, while chasing rabbits and playing with squirrels. And while Jimmy wrote that in India, Chris last year in your talk in Queen's University was brave enough to declare that the emperor has no clothes. The global healthcare system does not provide healthcare globally. The global healthcare system inflicts suffering to a considerable extent, while it certainly does some good also. And that is the humanity of all of you in Queen's University, Dr. Philpott. I cannot congratulate you enough for having this kind of human beings in your team. And I cannot thank you enough for this promise of radical collaboration. And instead of all the ugliness, maybe in future, look through your kaleidoscope often and give voice to these people. A writer from my country, a Booker Prize awardee, Arundhati Roy, wrote, there is no such thing as the voiceless. There are only the deliberately silenced or preferably unheard. That 50-odd million people from low and middle income countries, the multitudes of millions of people who are impoverished by healthcare costs, have been deliberately unheard. You sitting there in Queen's University chose to hear them. And I must, from all of us in Pallium India and my colleagues in India, I thank you. Thank you for this huge honor. I look forward to our work together and to the beautiful view that our kaleidoscope will someday show us. Thank you very much.
Being able to work with you and your amazing team. A mark of a formal agreement and your formal announcement of professorship. But I look forward to our continued friendship, our continued collaboration, and our continued working together. I also look forward to continuing the celebration when we visit in September and giving you a handshake and a hug, and also hugs to all the other members of your team there as we reunite in September. I'm really looking forward to that. Thank you, Dr. Philpott, for joining us today. Thanks, Dr. Booth, for your kind remarks. And thanks to all of the Pallium team. Although Raj is an inspiring leader, the work you do as a team is truly inspiring. And thank you for all the members of Pallium for joining us today. And thanks for the members of our Queen's Global. And with that, I'd just like to say thanks to everybody and congratulations finally once again to Dr. Rajagopal, our newest and first professor of global oncology. Thank you, Raj. Sorry, I can only see you if I look away from the camera.
Thank you. Thank you very much, Dr. Philpott, Chris Scott, all your colleagues, everybody. Thank you. We cannot thank you enough.